But within just 3 months of their daughter's birth, Pam and Dave Barquette know all too well that her life is in danger. In the spring of 1995, Pam and David Barquette were busy preparing their New Jersey home for their first child, a baby girl.
We found out she was a girl, which is really what I wanted, and I was so excited. I couldn't wait to go shopping.
I was overjoyed. We fixed up a brand new room for her.
It was a positive time.
With her pregnancy going smoothly, Pam eagerly looks forward to each doctor's visit to learn how her baby girl is doing. But at her 8-month checkup, a routine blood test reveals something out of the ordinary.
All the prior ones were normal, but this one wasn't. It was the alpha-fetoprotein one.
This standard test checks the levels of protein and hormones being produced by the fetus. High levels of alpha-fetoprotein can often indicate a birth defect. It's the last thing the Barquettes ever expect to hear.
They said it could be just a false positive, or it could be Down syndrome.
I didn't know if I was special enough to have a special child. Most people have the anticipation of having a normal child.
I was so scared, I didn't know what was wrong.
As a next step, the doctor performs an amniocentesis and an ultrasound to confirm the findings.
The amniocentesis test was slightly high, but after the ultrasound, they told me everything was fine. She had all the correct organs. There was nothing wrong with her, so I was very relieved.
1 month later, on May 31st, Danielle Antoinette Barquette is born, weighing 6 pounds and 6 ounces.
First time I saw her, she was like a little peanut, tiny. She was really, really small, but very, very beautiful.
The doctors came, they handed her to me. She was fine. There was nothing wrong with her.
Relieved that Danielle is healthy, Pam and Dave take their daughter home and start settling into their new role as parents.
Danielle was an excellent baby when I brought her home. She'd sleep, she was happy.
She was just as cute as a button. She was really an adorable child.
But just days after bringing Danielle home, Pam and Dave begin noticing a disturbing pattern.
Feeding her was always a chore. You give her a bottle, no matter what time it was, she'd throw it up. So you give her more, she'd throw it up. Some would stay, some wouldn't. It was just a problem to feed her.
I just figured this was normal, how kids act. Most kids throw up until you get them on the right type of formula or get something that doesn't irritate their stomachs as much.
The Barquettes stock up on various types of formulas to see if Danielle can keep any of them down, but none of them seem to do the trick.
Feeding her came to be clockwork after a while, because we knew that as soon as we gave her the bottle, she was going to throw it up.
Not only is she throwing up after every meal, Danielle is starting to experience daily bouts of diarrhea. But Pam is even more troubled by the fact that her 3-week-old daughter seems to weigh about the same as the day they brought her home.
She wasn't really gaining weight. I realized there could be something wrong, and that's when I brought her to the pediatricians.
The doctor gives Danielle a thorough examination and isn't alarmed by her condition. She reassures Pam that her daughter probably just has a sensitive stomach and that she should grow out of it in a few weeks.
They said, well, we'll keep an eye on it. Next visit, we'll see what happens. I was happy with the answer the doctor told me because I didn't want anything to be wrong with her.
Over the next 3 weeks, Pam is hopeful that the chronic vomiting will start to taper off, but it doesn't. Meal after meal, she throws up. When Pam takes Danielle in for her 2-month checkup, she is expecting grim news and anxiously waits for the doctor to weigh her.
She did gain weight. Not a lot, but a little. So I assumed that it would just keep going up from there and that she would be fine.
Relieved, Pam continues to monitor Danielle's growth. And slowly but surely, she continues to gain weight. But when Danielle is 3 months old, the entire family notices an altogether different and bizarre symptom.
It was my father's birthday, and we were chatting like most families do.
I mentioned how Danielle was growing. And my son-in-law said, yeah, but it's a little funny.
My husband noticed she was checking on her, that her stomach looked really big.
He lifted up her little outfit, and her stomach was distended.
Danielle's stomach was round. She looked like she was pregnant as a baby.
3 months after Pam and Dave Barquette bring their newborn daughter Danielle home, they're sent into a state of panic when they realize that her tiny abdomen has nearly doubled in size. Pam immediately takes her in to the pediatrician, who is also alarmed by what she's seeing.
They looked at her and they said that she could have a hernia.
Danielle's stomach could be protruding because of a hernia, a bulge that occurs in the abdomen when an organ is out of place. If left untreated, hernias can cause irreparable damage to vital organs. The only way to confirm her suspicion is to admit Danielle to the hospital, where they can run diagnostic tests. It's the last thing Pam ever expected to hear.
I started to panic. I called my husband.
She goes, there's a problem with Danielle, and they're sending her to a specialist at Morristown Memorial. And I basically just dropped everything I was doing and just left.
And they rushed us to the hospital with her. And I had a surgeon meet me in the emergency room.
The pediatric surgeon immediately orders blood work, a CAT scan, and x-rays. As ER staff whisk their only daughter away, all the Barquettes can do is wait helplessly.
She's screaming and crying because she's scared and she doesn't know what's going on. It's just a scary thing to see that.
It was my instinct to want to be with her, but I knew that they knew what they were doing.
2 long hours later, the test results are in. Danielle does not have a hernia.
When they told me it wasn't a hernia, I had no idea what was wrong with her.
As Pam and Dave struggle to process this latest development, the team reviewing the CAT scan has figured out what's causing Danielle's distended stomach. Her abdomen is filled with ascites, a catch-all term for any fluid that builds up between the abdominal wall and the internal organs. They speculate that the fluid has been slowly accumulating over the past 2 months, explaining why Danielle was gaining weight, even though she couldn't keep anything down. Suddenly, the Barquettes realize just how sick their newborn daughter has been all along.
We're not doctors, we're parents, and it comes with no instruction manual.
At that point of our journey with her, we had no idea of what we were facing.
The news is worse than the Barquettes ever could have imagined. The ascites is slowly crushing Danielle's tiny lungs. If doctors don't act fast, the fluid that's accumulating could stop her from breathing.
My biggest fear is that Danielle was gonna die. And it was very hard, because I didn't know.
The team rushes to drain the excess fluid by inserting a catheter into Danielle's tiny abdomen.
I'll tell you honestly, I would have rather had somebody tear my eyes out than look at my daughter on this table.
But right away, the procedure seems to be working, and for the moment, Danielle is out of danger.
They were able to stabilize her once they drained the fluid out of her stomach.
Now that they have stabilized her, the team can focus on pinpointing what is causing the ascites. And despite their initial sense of relief, the Barquettes settle in for the longest night of their lives.
I spent the night in the hospital because they wanted to run more tests. It was a long day. I was tired. Sleeping was not an option.
How could you sleep? You know, you don't even know what's wrong with her.
All I did was watch her all night. I couldn't really hold Danielle because they had IVs connected to her. So I would just stand over her and touch her little face, her hand.
The thing that we did the most was pray.
The next morning, when the doctors check in on their tiny patient, they're shocked by what they find. For the second time in 24 hours, Danielle's abdomen is full of the deadly fluid. Once again, the clock is ticking, and the medical team begins running a battery of tests in a frantic effort to figure out exactly what's going on.
I had every specialist, resident, come in and out of our room because they didn't know what was wrong with her.
I believe that they started out with the basic things, obviously blood tests and urine tests and things of that nature, trying to rule out if there was any levels that were way off the chart.
But as each test comes back, result after result shows that Danielle's heart, lungs, kidneys, and liver are all normal. For the next 3 days, the barrage of tests continues with no new leads. Desperate for answers, the Barquettes begin to wonder if anyone will be able to save their little girl.
I would think, oh geez, what's next? They've done all these other tests. They still haven't found it. What could be left?
With Danielle's condition rapidly deteriorating, the hospital calls in gastroenterologist Dr. Joel Rosh.
Every minute counted. It was that type of situation. You feel pressure to make a diagnosis and hopefully effect a cure yesterday.
Shook my hand and said, let's see if we can't find out what's wrong with her. I think he immediately went over. I think he put his hand on her head. I'll tell you what, it meant a lot to me.
A specialist in digestion and liver disease, Dr. Rosh is deeply troubled by what he sees.
She was obviously a very ill infant. Her abdomen looked like one of those old-fashioned Jiffy Pops. That is not a good sign.
He immediately suspects that her liver is shutting down, causing the fluid to build up.
The most common cause of ascites, certainly in adults, is from the liver.
But so far, all Danielle's liver tests have come back normal.
Even though her typical tests of liver chemistries were not suggestive of a significant liver problem, the question was, could this be coming from the liver anyway?
Determined to flesh out his hunch, he delves straight into Danielle's chart, scrutinizing every test they've run on her in the last 5 days. And it takes him only moments to notice one important test that has yet to be performed.
The best liver test that we have to tell me is the liver working is a test of clotting. That had not yet been done.
One of the most important functions of the liver is to create proteins that cause our blood to clot.
Once the liver begins to fail, the proteins that need to be made to allow for normal clotting are no longer made, and so the blood clotting test will become abnormal.
And just as Dr. Rosh suspected, the test results are the first real breakthrough in the case.
They were markedly abnormal, which was a sign to me she was in severe liver failure.
This is the clue that Dr. Rosh has been looking for, but the revelation also means that Danielle is sicker than anyone had ever imagined.
I really thought she was going to die. I just was going to say goodbye.
For the past 5 days, Pam and Dave Barquette have watched more than 30 doctors struggle to save their only daughter's life. Now, gastroenterologist Dr. Joel Rosh thinks he knows what's causing her stomach to fill with a deadly fluid called ascites. Her liver is failing, and he suspects he knows why.
There are not many things that would put a 2 to 3 month old in severe liver failure. And then putting together the fact that she had basically normal tests that look for inflammation of the liver, I knew I had a relatively non-inflamed liver that just wasn't working. That smells a lot of very rare condition.
To prove his theory, he turns to Pam, hoping that she can provide a vital piece of information.
One of the markers is a very high alpha-fetoprotein. Knowing this is what made me ask the mother if she had ever heard anything about alpha-fetoprotein. And she sort of gave a laugh and said, oh, come on, someone must have told you that story. And I asked her what story, and she told me the whole story about the obstetrician and the elevated alpha-fetoprotein.
Dr. Rosh immediately orders an alpha-fetoprotein test for Danielle. And the results are the last piece in the puzzle.
The alpha-fetoprotein is a protein that comes about from damage to the liver. And normal alpha-fetoprotein in an infant may be several hundred. Hers was 77,000. And seeing that level of elevation is almost diagnostic. We were dealing with tyrosinemia.
Tyrosinemia is a genetic disorder caused by the lack of an enzyme needed to break down tyrosine, an amino acid that is found in most foods high in protein, like meat, eggs, and dairy.
Infant formula, the regular formula, breast milk, anything that an infant will be eating has protein, and those proteins have tyrosine in it.
If patients with tyrosinemia continue to eat these proteins, toxic levels of tyrosine will build up in their system, poisoning their body.
Every time Danielle ate, she made herself sicker.
This explains her vomiting and diarrhea.
It started making sense. She couldn't tolerate the formula because she didn't have the enzyme to break it down.
In Danielle's case, her tyrosine levels were so high, they actually started to poison her liver. In response to these toxic levels, her failing liver quickly became unable to process fluid normally, causing her stomach to fill with deadly amounts of ascites.
Untreated tyrosinemia is uniformly fatal. So in a sense, the ascites did her a great service, because I don't know that we would be talking about Danielle the way we are today had she not gotten that swollen belly and sort of called attention to herself.
All the pieces came together. I was relieved. At least I knew what I was dealing with.
The Barquettes are thankful to finally have a diagnosis, but they still can't help but wonder why more than 30 doctors missed the critical clue.
One of the curveballs that tyrosinemia can throw, the liver doesn't get destroyed. In a sense, it gets poisoned. So the tests that would tell me about abnormal turnover or death of liver cells don't clue me into a liver problem.
In addition, because tyrosinemia is so rare, only 1 in 100,000 children in the United States are born with it, it's not included in the wide range of tests medical experts usually run to assess the liver.
It's very rare, and most doctors have never seen it. I was very lucky that Dr. Rosh saw this other case.
I diagnosed a child with tyrosinemia about a year or two prior to Danielle. So those clues don't have to be quite as loud or quite as large if you've already seen a case.
He knew exactly what to do and how to handle it.
With a diagnosis in place, Dr. Rosh begins treating Danielle with an experimental new drug called nitasinone, or NTBC.
After he was confident that it was tyrosinemia, he let us know that there was a company in Sweden that developed an experimental medicine that could help trick the liver in the processing of protein.
Within days of the diagnosis, Dr. Rosh administers the first dose of NTBC, and almost immediately, Danielle's life begins to change.
Once the NTBC, once the medication, which helps reverse the whole process, was given, within days she had a marked improvement.
She was eating and her stomach wasn't holding fluid anymore. She just seemed to be more alive. It was just, I knew she was going to be okay.
After 2 long months, Danielle is finally out of danger, and Dr. Rosh expects that with the proper treatment, she'll be just fine.
For the rest of her life, Danielle needs a special diet, which is low in the amino acids, especially tyrosine, and she requires the medication NTBC, which is now FDA approved and available in this country.
Today, Danielle is 12 years old. She's a seemingly normal 7th grader who has learned how to live with her disease.
Danielle's health is fine. She's still on a low-protein diet and the drug.
I have to take 2 pills in the morning and 2 pills at night. It doesn't make me feel different. Well, it does, but I know that they can't really change it, so.
I don't feel that this was a step backwards for us. I think this is a very special thing to happen to her because it can help other people.
In a sense, she's writing her own book. Danielle and patients like her are going to tell us the long-term effects of her therapy.
Danielle's case has helped to prove that if diagnosed in time, genetic metabolic disorders like tyrosinemia can be successfully treated.
When babies are born in New Jersey, they test for 30 metabolic diseases, and now tyrosinemia is one of them.
Danielle is proving that each of these patients has a bright future in store.
Danielle is healthy, happy, extroverted, developing and growing like any other preteen. It's a wonderful thing to see.